effectively? Because it does begin, your point in private practice where the doctor, those patients, the 80+% that are in the community, how do we begin to connect those dots? Your national goals as advocates, your focus as a physician, your organizational needs, and you out there in the community, how do we reach the patient that needs to find their voice to do this?
I really believe healthcare reform, the healthcare reform debate, took all of America into that debate. And I think more people realize they need to be advocates because whether they liked what was in healthcare reform or whether they disliked what was going to be in or what they wanted to influence to be in or not be in, there basically was that period in August before the healthcare reform debate where there were some heated town halls, plus and minus. So I think that's very important. And I think that, you know, we all have a responsibility, again, for our health care. It is our country, and we have to not have any sense of intimidation also, because going to Washington, D.C., I know a lot of people who have come up said it's a very intimidating experience. You know, when we are all there and you walk the steps of the Capitol all the time in the office buildings, it's not intimidating. A lot of people come up intimidated, and they have to realize that they're paying their representatives. That's right. You know, and with all due respect for the men and women who serve, they are paying them. They are their representatives.
I know that we can sit for hours and talk about the technical details involved in drug manufacture, distribution, and reimbursement. We can bore you to tears with all the nuts and bolts of that whole process. And when shortages were really in crisis last spring and summer, we were all over the place talking to everybody we could talk to about this problem. But one individual who had a child being treated for acute leukemia in Iowa had probably the biggest impact by going to their senator's office and saying, I'm being told that my child needs preservative-free methotrexate and it's not available. Or an adult with acute myelogenous leukemia who needed Ara-C and it wasn't available. And those personal stories raise everybody's antennae and generate a whole lot more momentum and urge to act. It's one thing to be very precise and very technical, and it needs to be data-driven. It needs to be correct. Anything that we say publicly, we try to make it as correct and as precise as possible. But it has to be also, there has to be a personal connection. And I really think that's where the ultimate recipients of health care, our patients, are so important, is that if they're empowered to speak, then that's a much more powerful message than anything that anybody on this panel can deliver in Washington.
When the FDA was scheduling their hearings for September the 26th around drug shortages, we called a young patient with whom we were working. And she was 17. We're on the phone with her mom and said, we'd really like to bring you to Washington. You really need to have this conversation. You and your daughter can really make a difference for 300 million Americans. And the question the mother asked was really part of the answer to your question. And she said, we can really be a part of this public policy discussion as a question. And so I think sometimes the way we bring the patient into public policy is to say to every single patient with whom we interact, and everyone in America, you are public policy. Your voice is public policy. Your culture, your philosophy, your vision of what you want America to be tomorrow, you are public policy. And sometimes it's as simple as inviting them and saying, you can be a part of this dialogue. And I think we all have to do that. At PAF and NPAF, I think everyone knows we do collect a lot of data across every patient that we serve. The data drives policy discussions, but we never have a discussion without that patient.
After 9/11, there were a handful of women who were unsatisfied with what the government was doing. And by the way, it's their government. It's our government, it's their government. It's not the politicians' government. And they're affectionately known as the Jersey Girls. And I can say that, we see bad connotations of Jersey. My wife is from New Jersey, but they're the Jersey Girls. And they were women who lost their spouses in that tragic event in 9/11, and they were not satisfied. And they went and collected the data, made sure it wasn't just an emotional argument. They collected the data. They demanded better of our government, and as a result of that, so many of the policies that have been put into place, which has been effective in terms of stopping terrorism and not having another 9/11 attack, were because of those handful of women who, they will tell you, knew nothing about the government, knew nothing about how the government works. So I think that you don't have to be intimidated because it's your country, and I think that we can take a lesson in that in terms of the area of cancer advocacy.